All that and the hot topics you want to hear coming up live on The View.
Why get dad a tie and golf balls this Father's Day when you can get him a neck lift and Botox? More men than ever are getting plastic surgery these days, and today we're finding out why and what they're getting from plastic surgeon Dr. Francis Palmer. Welcome, doctor. Thank you for joining us. Okay. I'm actually surprised. I didn't realize how popular this was with men these days. But what are the most popular procedures, and what concerns you the most as a doctor about this?
Well, Meredith, let me start out by saying that 1/5 of all the plastic surgery procedures performed last year were done on men. So when they come to see me, basically what they want to do is they want to look less tired. They want quick, simple, easy procedures. They want no downtime, and they don't want anybody to know.
Mm-hmm. Okay, so they're not trying to look like someone else, like some women might. They just want to look...
Not at all. They're not vested as much as women are. Women come in and they really want to look dramatic. They really want to be youthful. Men want to look less tired.
Why are they so afraid of looking tired?
Because society's not nice for
men
who have plastic surgery.
I think.
All of a sudden, if you're a man, you have plastic surgery, you're less of a man. And that clearly is not true, but that's the stigma we're in.
Absolutely, at least at this point. Now, there are a lot of common procedures, so we're going to get started. But I want to warn the audience, particularly at home, that some of these images are very graphic. So if you want to get the kids out of the room, please do so now. We're going to start with the custom mini lift with geometric neck lift. Oh, Lord. What is that procedure, and what kind of results can you see?
Well, I really call it the Palmer Celebrity Lift, and I designed it with really small incisions with very little downtime. And what you're going to see here is there's extra skin of the neck, extra skin of the face, and I want to do a special little incision underneath the chin. So the beauty of this is really when I dissect the tissue, I do very little. So when I pull it back, as I'm doing here, the underlying muscle layer, and I trim it, there's almost no disturbed tissue behind because that's what creates bruising and swelling. So there's almost no bruising and swelling with this procedure. A little incision, you can see this guy looks 10 years younger, 90 minutes or less, under a local anesthetic, no general.
But that before picture used to be attractive to women and men for years and years. All of a sudden, a man has to have a different, less tired look. I don't get it. What's going on?
I'm not sure that's true. I think what's happened is we become sort of more aesthetically involved. And what was like rugged and kind of droopy, the guy says, you know, I don't want to look like my dad anymore. I want to look a younger version of the way I am.
Give me the damage on this one, and how is it different from other facelift procedures?
Well, you know, it's about 8 to 16 grand. It depends on how much facial contouring goes with it. And it's different because the incisions really are full 6 or 8 inches less. So you're talking about very quick recovery, little bruising. 1 or 2 days, this guy goes back to work.
And nobody knows the difference.
So he can take off on Friday and go back to work on Monday, and he'd be fine.
What guys usually do is they grow the beard for a week. By the time they shave, people say, wow, you look terrific, but nobody knows why they look terrific.
Interesting. You just look better. The next procedure is very common with women, too. It's called an eye lift. What makes a man a candidate for an eye lift, and how do you do the procedure?
Yeah, I think this is a really good example. Basically, eye lifts are for people who have excess fatty tissue or skin around the eyes. It just makes them look tired. So here in the animation, what you're going to see, we put a little incision in the eyelid crease to hide it. We're going to remove some amount of skin, muscle, and fatty tissue. Close it with a dissolvable stitch. I do these under local as well. And you'll see afterwards, from our after procedure, you'll see that he looks just more rested.
Right.
It's tired to not tired. That's an eye lift.
And often guys have a little extra skin under the eye as well. Do you remove that?
Sure, that's easy to do. I mean, you just pull the eyelid apart, pull it away from the eye, and make an incision.
It's
It's not a lot of surgery. And then you just take the fat and you sew it up. There's not even any incisions.
Saute it.
Surgeons never say saute.
How long does this procedure last, and tell me about how much this costs?
You know, BLEF usually is somewhere between $3,000 and $8,000, but it is one of the very few plastic surgery procedures. If you do it right the first time, you never need to repeat it.
But that hurts, doesn't it? That looks like it would hurt.
To cut this open here? I'm not allowed to hurt people. It says in my contract.
Is that so different than a woman's eye lift would be, is it?
No, it's exactly
the same.
That's dramatic. That's very dramatic.
And exactly. What you see here is excess skin and bags. You can go inside. There's not even an incision underneath. You take it out, several days later, this guy's just going to look less tired.
That would
People don't
scare
know
me about keloiding or something on my face. But no scarring.
No, you won't keloid. Even dark skin. It's funny. You'll keloid in the earlobe, but if I go right around the earlobe, no. And the eyelid is
it's
almost...
the same thing?
It's so unbelievably rare. It would be a reportable case.
You mentioned facial contouring, which is a non-surgical procedure. There's something you call radius, is that it?
That's correct.
Facial contouring, which is not approved by the FDA at this point in this country. So if a man wants to change the contour of his face, tell us how he would do it using this contouring approach.
Yeah, I think what men want to do is they want to look more masculine, more handsome.
He looks very masculine right now.
And that means...
This guy.
That, well, I'm going to make him even look better because this is a little drawn. If you look at this face, it's a little rectangular. So what I'm doing is I'm marking his face to give him a little bit more depth to his cheek. And it's an injectable paste as an office procedure.
That doesn't hurt that much.
It really doesn't.
No,
and what I'm doing now is I'm massaging it. Think of this as a moldable paste that I can create a face with. And it is actually approved for certain things, and you can use it off-label.
What were you putting in there? What were you putting in there?
That's the radius. It's calcium hydroxyapatite.
And
it's like a component of the bone. And it'll build it up.
Steven's right here. The proof is in the pudding. This is Steven.
She's shocked.
I didn't know he was coming. You look good.
Well, thank you.
Why did you want to, Steven, why did you want to
I'm in PR. It's important for a youthful look. And, you know, looking at my father, the way he aged, his face just sunk.
And you saw
And I
yourself
just had to take a little step forward on it,
Is this expensive for you? And, like, do you have to keep going back, doctor? Does he, how many visits does he have to, say, expect in a year?
Yeah, the radius is somewhere between $1,500 and $2,000 per syringe. For cheeks, I'm going to use 2, so $3 or $4 grand. For the chin, I can use 1, and for the jawline, it depends. I can really make a nice jawline.
So it's pricey.
He also had the Botox, right? Correct.
Right.
Okay, and that's
So I
between
could
his
be
eyebrows
looking
and
at
his forehead.
$10,000 just like that.
Yeah, but think of it
squash
this
it
way.
scars.
No implants, no surgery, no general anesthesia. Simple office procedure.
Nobody was it worth it?
Was it worth it? You love
See,
it?
that's the thing. If
Did
you
it
can
hurt?
afford
Did
it,
it
he's
hurt?
worth
No,
it.
I really did not. He's
2 to
really
5
very
years it
talented.
lasts. That's not bad.
Interesting stuff. Our thanks to Dr. Francis Palmer. And for more information, log on to our website. When we come back, my kids are looking back at growing up in front of the camera on The View.
We're saying so long to Meredith all week long like only The View can. With goodbyes from the staff. Meredith taking a look back at highs and lows of the last 9 years. And on her last day, we're giving her a roast with celebs, surprises, and stinging sarcasm that'll have her running to get out of here.